Hi, I'm Dr. Barbara Ezrre with Desert Wellness Center. I've found in my practice that one of the most common reasons that people don't feel well is related to food sensitivities. A lot of people are really familiar with food allergy reactions where someone, for example, eats a peanut and right away they feel their throat swelling up and tightening and then they can't breathe. So that's a very extreme type of food allergy reaction, but it's not the most common type. The most common type is actually a delayed food sensitivity reaction. And so this means that a person eats a food and hours to days later, symptoms begin. So most people, when they're not feeling well, they don't usually think back, well, what did I eat 2 days ago or this morning, which might be contributing to how I'm feeling. And so they can be very difficult to pick up and determine on your own if you don't have the help of someone who's very trained to evaluate food sensitivities. The most common symptoms of food sensitivities can be digestive related, so this might be like gas, bloating, constipation, diarrhea, acid reflux, heartburn, very, very common symptoms. And they can also be very generalized symptoms, so without even having any digestive symptoms. The common generalized symptoms are fatigue, headaches, joint pain, brain fog, muscle aches, even mood changes, as well as environmental allergies. So if we look at the immune system as it gets overburdened by the response to foods that you're eating, it'll start becoming very reactive to things in your environment. So a lot of times seasonal allergies can be very much related to what you're actually eating. The most common food sensitivities are dairy, eggs, wheat, rice, soy, citrus, and sugar. Food sensitivities can be determined through a quick blood test, which can either be a finger stick or an actual blood draw, and that can be done at any time during the day. It doesn't need to be done fasting. We do that here in office. Also, we can determine food sensitivities through an elimination and challenge diet. So what I'll do with patients is I'll give them a list of foods that they can eat that fall into a very hypoallergenic diet, and we eliminate the most common food sensitivities for 2 to 3 weeks, and we'll discuss meal planning so it makes the whole process as easy as possible. And then after the 2 to 3 week period is over, then we add the foods in one at a time and we monitor for symptoms. So usually during this time, patients will feel much better as they're avoiding the foods that they've been reacting to. And then as we add the foods back in, then the symptoms start coming back. And so I'll have patients keep a food diary so they can really monitor how they're feeling to be able to really tie in the symptoms with the foods that they're eating. If you're struggling with any of those symptoms, the digestive issues, the generalized symptoms like fatigue, brain fog, seasonal allergies, headaches, joint pain, call our office. Let us help you figure out how your foods might be contributing to how you're feeling.